Hello, and welcome back once again to Surgery 101, the podcast series brought to you with the help of the Department of Surgery at the University of Alberta. This week, we're presenting a short video on some of the work we've done here at the U of A, looking at the assessment of medical student performance. And this is a talk that I gave a few weeks ago at the Canadian Conference for Medical Education, which our team was attending, which was this year in Quebec City here in Canada. And it's a talk called Who Writes What? And it's about written comments in team-based assessment looking at medical student performance. It's a study that I did with Nishan Sharma, who used to be our team lead for undergraduate education at the University of Alberta, and I hope you find it interesting. So, what's the point of this talk? Well, really, I'm interested in assessment of medical students. I'm interested in observing their performance in clinical environments, so I want to see how they do on the ward, how they do in the operating room, how they do on call, how they do in the emergency room. Because it's a key part of assessing them and making sure they're learning what they're supposed to be doing. So, we developed a special model of team-based education and team-based assessment here at the U of A. And as part of that team-based model, we get a variety of assessors to give written comments about our students. And really we wanted to look at those comments. We wanted to look at the quantity and the quality of comments that our students get, and look at what people are writing about, what aspects of performance get written down when an assessor is asked to write comments on a student. So here's a graphic summarising our model. It shows you all the different people who get to give feedback on student performance. Of course, there are physicians, so there are multiple surgeons and multiple anaesthesiologists, but there are also nurses, both on the ward and in the operating room, also residents who are working with our students, also the clerkship administrator gets to give feedback. And there's also feedback given from peers, medical student peers, and also the medical students' patients. So those are the types of people who are assessing our medical students. It's more than the usual traditional preceptor-based model, which is really just physicians. There's other people, apart from physicians, looking at our students and giving them feedback on their performance. So we're deploying this model in a 7-week clerkship on general surgery and anaesthesiology. And we ask our assessors to give students feedback based on things they're good at, so like areas of excellence, and also things they can improve upon, areas of improvement. We've been collecting these comments for a while. We use mixed methods to analyse the comments which were provided and trying to generate a framework to describe who writes about what. So here's an example of an assessment form. This is a patient assessment. You see the student's name and ID number goes at the top, and then the patient writes there, and then they have to write down at least one area in which a student excelled and was really good, and at least one area where a student could improve. And you can see they also have to tell us whether the student was professional or not, and they also have to fill in some metrics and ratings at the bottom. We've published our work on those ratings before. I'm not going to talk about those further here because we're focusing on the comments. So the question we were setting out to ask was, what is it that assessors observe about medical student performance in the workplace? Like, what do they see? And that's a hard one to answer because you're not there to see what they see at the same time that they see it. We can, however, consider what they write down about what they see, which is a different thing. You might see certain things but not write about them in the comments, of course. We can examine what they write down with this study. We want to know, are there common things that they write about? Like, do nurses see the same things as doctors, the same things as patients? We also want to look at the differences, so that different groups of assessors see and write about different things. And we have published this work. If you want to read it up in more detail, we published it in BMC Medical Education last year as well, under the same title, Who Writes What? So let's look at the results. We got a lot of comments, and as you can see, there's a lot of data on this slide. I don't want to overwhelm you with it. I just want to focus your attention on the bottom line there. We got almost 1,200 assessors who gave us almost 3,000 written comments. And you can see the overall ratio of excellence to improvement was about 3.8 to 1. So for every one comment that a student got saying they had to improve, they got almost 4 comments saying that they were really great. And you can see that the hardest assessors were actually the chief residents. They only gave out 1.8 nice comments for every one comment for improvement. And the most positive people, most positive assessors were the patients, who gave out 9 nice comments for every comment suggesting improvement. Our average student here got a total of 26 comments, and that range was from 13 up to 37. So each student got a lot of different comments from a lot of different people. And the average number of areas for improvement were 5, and some students got up to 12 comments for areas to improvement. So you see the average student here got 31 separate written comments, 26 on areas of excellence, and 5 for areas of improvement. When you start to look at that's the quantity of data that we got. We start to look at the quality of the data. Really, it's a very rich data set. There's a lot of material in it. People write about lots of different things. Write about professionalism. They write about communication. They write about teamwork. They write about personal things like pleasant and manner, bedside manner. They talk about reading. They talk about working and learning. Lots of different things here. So if we can summarize then, what are the kind of key things they talk about? We think there are probably 4 main domains here that people write about. First is student as physician in training. The second is student as learner. The third is student as a team member. And the fourth is student as a person. And I'll break these down in a bit more detail now, tell you what's inside each domain, and tell you who writes what, essentially. So here are the first 2 domains. So physician in training has 14 subdomains, and it's really comments about what a medical student is training to do as a doctor. So there's some knowledge in there, there's rapport, there's communication, physical examination, there's some organisation in terms of managing information, thinking it through, writing it down and presenting it orally, and there's also some stuff on technical skills. And then for learner, that's physician in training, and for learner, which is the one at the bottom, you've got a total of 8 subdomains, and it's things like interest, enthusiasm, initiative, preparation for learning, openness to feedback, progress and improvement. And then at the end there are a couple of subdomains on confidence and career suitability. So let's look at physician in training first. Who writes about physician in training? Well, mostly it's physicians and residents. They write about medical knowledge, write about communication, organisation of findings, technical skills. The nurses write about some aspects of physician in training, but not as many as physicians and residents do. Interestingly, patients also write about physician in training specific areas. They write about the students' communication skills. Interestingly, they write about physical examination because they're the people being examined. And they also write about technical skills or procedures that medical students have done. When we come to learner then, which is in green here, lots of different people write about the learner domain. Physicians and residents, and also OR nurses and ward nurses. This is presumably because OR nurses and ward nurses are quite used to having nursing students, and they're quite used to interacting with medical students, and they know when they see a medical student they can tell if they're prepared, they can tell if they're good at asking questions, how good they are at feedback, taking feedback, that sort of thing. Also, peers write a few questions or a few comments about the learner domain as well. Because obviously they're in the same boat, they're also medical learners, and they look at their peers and they go, is this person prepared? Are they asking questions? Are they trying to learn? Administrators don't write much about medical students as learners, and patients don't really write much about them as learners as well. They do sometimes talk about progress and improvement and confidence, and also career suitability. The other 2 domains then, we've got working team member and person. So working team member, which is in yellow here, it's about being helpful and helping the work of the team. So work ethic is in there, organisation and time management, also conscientiousness, helpfulness, communication, cooperation, following instructions and leadership. Who writes about these domains, or this domain, working team member? It's really the people who work most closely with medical students, so residents, OR nurses and also ward nurses. And in addition, peers. In fact, peers write pretty much the most about working team member because they have to coordinate with their fellow students, they have to share a call with them, they have to work closely with a team on them, so that makes sense. Interestingly, the patients wrote pretty much no comments at all about working team member here because they don't really see the students as a member of a team, they see them as a trainee doctor. And then there's the domain person, student as person. So this domain is about things like compassion, patient-centeredness, personability, humour, politeness, resilience, common sense, honesty and integrity. This is one of those domains that has a lot of comments written about it. People like to write about students as people. And as you can see, ward nurses wrote a lot about this domain, also peers and patients. And physicians and residents and OR nurses actually didn't write too much about the student as people. It was mainly nurses, peers and patients. So let's go back to our original 4 domains here. Student as physician in training. Who writes most about that? That's residents and physicians. What about student as learner then? Mostly physicians write about student as learner. They covered 100% of the subdomains in student as learner. Student as team member. Those comments come largely from the people that the students work with, residents, peers and nurses. Student as person. Peers, patients and nurses write largely about student as person. So, what does this all mean? Well, we observed a wide range of performance that was recorded in the written comments that were provided to students. And I think this study shows that non-physicians do observe and write about important areas of student performance. I mean, the nurses saw things, the patients saw things, residents and the peer students wrote about important things. How does our framework connect with frameworks, say, like CanMeds? So, where do our domains go here? Well, there's physician in training, there's learner, there's team member, and there's student as person. We think physician in training probably fits quite nicely with medical expert, because that's what people are training to do, to be a medical expert, to be a physician. That fits quite well. There's some aspects of learner that fit nicely with scholar, so we think actually scholar maps well with learner. Team member, we think it pretty clearly works with collaborator, because you have to collaborate and work closely with the people on your team. So we think that's quite a nice match for CanMed's collaborator. As other people have said, we have some questions about where the person is on the CanMeds flower, where some of those personal capacities are, where some of those personal descriptors would be. Now, I don't think CanMeds covers that very well sometimes. What about limitation to the study? It's, as I said earlier, it's words that are written down on paper, it's not thoughts. So we can't tell what people actually saw, and we can't tell what they were actually thinking. We can just tell what they chose to write down. There was only one administrator in the study, so we're limited with our observations there. We think there's a possibility of queuing from ratings items. So if you look at the bottom of the form where the ratings items are, maybe some people queued their written comments from there, although we don't think there's much evidence of this in our data analysis. And lastly, it's hospital-based, it's not community-based, and it might be interesting if you employed a tool like this in a longitudinal community-based clerkship. So in conclusion then, we think we've shown that different groups of assessors provide comments on different aspects of student performance, and we think that comments that come from a single viewpoint could potentially underrepresent or overlook some important areas of student performance. And we hope that the framework that we've developed here can serve as a basis to better understand what medical students do every single day, and to understand how medical students are perceived by those with whom they work. This work was supported by a grant from the Evidence Civic Employees Fund, and we're very grateful for that. And we also like to acknowledge the assistance of Jenny Marshall, Shannon Erickson and Joanna Zuprin, who helped a lot with this work. That's it for this week's episode of Surgery 101. If you've got any comments for us or questions, please drop us an email at surgerypodcast@gmail.com or visit us on surgery101.org. Rate us on the iTunes store or send us a message through the app. Thanks very much for listening, and we'll see you back here next week on Surgery 101.